Hello again, this is the Health and Science Focus. I'm Uveka Rangappa. Thanks so much for joining us. Well, how do you know if you have an eating disorder? Where and how can you get the actual help? Let's get some insight now into dealing with this. I'm chatting now to psychologist Dewald Louw. Now, he works at the Akeso Montrose Manor clinic, joining us via Skype today. Dewald, thanks so much for your time. And I mean, you're with this every day. This is what you're doing. Tell us exactly what your job entails before we get into what details you have to give us.
Absolutely. Thank you for being with you. I'm a psychologist at Akeso Montrose Manor, and we're a multidisciplinary team treating the whole spectrum of eating disorders, adolescents and adults, and we run a therapeutic program, obviously helping them with the food, but also with all the underlying feelings. And most of our clients stay quite long-term, I would say a couple of months, inpatient in treatment.
So who are the various professionals who are involved in treating something like a disorder?
It really takes a village, it takes a team, and we've got numerous therapists, psychologists, occupational therapists and social workers. That's the clinical team that mainly runs the therapeutic program. And then we've got a psychiatrist, we've got a dietitian, we've got often also a biokineticist that help with the wellness and the exercise, because a lot of our clients also struggle with over-exercising or a lack of exercising. So it's really a team effort.
So just take us through sort of a patient coming in, they've had this eating disorder, they need this help. What is the first thing that you actually have to do for them? Who is the first person? What's their first point of call?
The first point of call will be seeing actually all the individuals I just mentioned, just to get a proper intake and a proper background. We also get some information, collateral information from the families and previous professionals. Most of our clients have been in treatment before, all over the world, and often is then readmitted at our clinic. So our program consists of 3 phases, and in the first phase we first want to help them to stabilize their food and stop them from acting out, so from purging, from over-exercising, from maybe overeating. And we introduce them to a variety of meals and snacks, and we also choose and plate all food for them in the beginning, as clients find it very difficult to make food choices. So they need a lot of support and supervision, so staff will sit with them during meals and offer emotional support after meals when clients often feel guilty about what they just ate. So that's in the first phase. In our second phase, we challenge them a bit more. They start to serve their own food, make their own choices, and in the last phase, we really prepare them for reintegrating back into life. So we've got on our premises, we've got apartments and flats that they move into where they also have a kitchen. So they start to live with food around them, they start to prepare their own food, and they also go to restaurants, ordering food from restaurants, going do their own snack and grocery shopping. All that's very important when it comes to reintegrating back into real life.
I mean, how successful has this been for most of your patients, Dewald? Have many of them gone off to live sort of mostly close to normal lives? Do they have to check in with you maybe once a month? Is it constant therapy that is required after that? Or maybe when they have another spell, it's when they come back to you?
Yeah, I would say if we look at mental health disorders in general, eating disorders don't have a good prognosis, and it's one of those that you really need to work at afterwards. So it takes a lot of management. I completely agree with what all the professionals said earlier. It's not a disorder that's going to be fixed. You're not going to be recovered from the disorder. You're always going to have to manage this. So often they continue in an outpatient way, seeing therapists, where the family is also involved a lot, especially with adolescents, continuously looking at meal plans, how they spend their time, and it's often up and down. But I would say in most cases, the majority of clients learn to manage their eating disorder to such an extent that they can continue work, can go back to school, and can live a somewhat normal life.
Just from your side, because you are seeing this every day and you are working with patients every day, Dewald, as well, on the ground there. Warning signs again, early signs that, that there is a problem, whether it's with myself, whether it's with my loved one, with a relative, somebody I'm living with, a colleague perhaps as well. What are some of the behaviors we might want to start taking note of as an early warning sign?
I think the most obvious ones would be with regards to food, maybe skipping meals, never eating in front of other people. Most of our clients coming in would cancel any social events when they are invited because of the fear of food, which is very sad. If you think, a lot of my clients will tell me how they would not attend their best friend's 18th birthday because of the fear of having a slice of cake. And then a lot of secrecy, exercising secretly in a room instead of being honest about their exercise and their well-being. So these clients often tend to isolate a lot. There's a lot of comorbidity with depression and anxiety. So you will see, not only when it comes to food, but also on an emotional level, that something is bothering this client, and often then you start to connect the dots.
And as a support, the rest of the family, and I'm sure the family forms a big part of what you do there, even though you have a panel, a team of experts, the people that they're going back home to would be the most important people at the end of the day. What would you say to them about the role that they are playing? And this is a lifelong role. It's not just for a couple of weeks or months or years.
Yeah, absolutely. In our treatment also we involve the family a lot, and that's so vital. The family, or especially with adults, it might not be the family always, but it might be peers, even good friends, whoever's going to be there afterwards to support them. And I think eating disorders are very much misunderstood, and most people think that when you've got anorexia nervosa, you just need to have more food and eat more. And that's often where the families struggle, and they get it wrong, and their focus is very much on the food and not enough on how the client is doing. We often say that the client used the eating disorder almost as a voice to demand care and attention from the people around them, because they maybe don't have the assertiveness and the voice to somehow communicate what they actually struggle with. In the acute phases, directly after treatment, unfortunately, a lot of the times the family will have to still sit with the clients afterwards while they have meals, and also have meals with them, because it's very difficult for our clients to have meals by themselves if the person around them is not eating.
And what if the family is the problem, dear Falk? I mean, we all have, those aunties, we all have those people in our circle. The moment you walk in the door, oh, you've put on a bit of weight. Oh, look at you. I see the holidays have been good to you, I think we need to stop behaving like that as a society.
Absolutely, and I think the focus is once again very much on appearance and the food. And what I say to my parents and the families, I say to them to stop making comments about the weight, stop making comments about what they're eating, and start checking in with the child and with the person emotionally. How are you doing? What's going on at school? How's it going with your friends? That's often very helpful, because for someone with an eating disorder, while they're having food, they're already so preoccupied in their head with the calories, is this food too much? So the moment another comment is made about food, it's often overwhelming for them. They actually need a lot of distraction while they are having the food. We often just put on the radio and play a song. We have games at the table, where they change the topic and they talk about their favorite subjects at school. They need to be distracted from the food. We need to move away from the body and the weights and the food. That's really most helpful for them.
Oh, thanks very much. Sound advice there. Thank you so much, Dewald, for that. I mean, he works with people every day. He absolutely knows what he's talking about there. Well, as we round up our health focus this morning, let's chat now to anorexia nervosa survivor Jacky Schwarz. Jacky, good morning, and thanks so much for giving us your time and sharing your experience with us. And just take us through your journey. When did you realize, or when were you diagnosed as having anorexia nervosa?
Thanks so much for having me here. I realized when I was a teenager, I had a lot of body image issues. I hated my body. I hated myself. I was depressed all the time. If I wasn't doing sports, I was sleeping. And, after years of sort of living that lifestyle, you kind of realize that there is almost a diagnosis to what you are living.
If you're able to tell us, Jacky, was there an underlying reason? Was it just the fact that you just didn't like who you were seeing in the mirror? Or was there something else? And only if you're able to share that with us. Was there another trauma that was behind all of this?
Not a problem. I did suffer from depression as a teenager, specifically very, very badly. And I think not dealing with things and, you know, you become an extremely insecure person and you take what is said around you extremely personally. So, you know, I did a lot of sports, so there was body comparisons in the changing room that obviously lingered on my mind more than it would with a peer. So I think the depression sort of manifested itself over the years into anorexia.
And, you know, between the ages of 13 and 18, I mean, this is when you went through all of this. Just what was your life like? Tell us, you know, what was a day in the life of Jacky like? Because we've been hearing from our experts about, yes, it's secretive, people are good at hiding it. Tell us what it is you went through day to day.
Absolutely. So at first I was gradually limiting my meals. I had no food education on calories and fats and things like that. I just knew that the least I ate, the more effective the weight loss would be. And then obviously as much exercise as possible as well. So I was extremely sporty. It got to a point where I was limiting myself to a few Provita crackers and popcorn every few days just to keep me sustained enough. And very secretive. I did sports, I came home, I slept till the next day. I didn't speak about it. I hid food away. I would actually, you know, give my lunch food away, hide it in my cupboard, and then forget about it. And then, you know, months later, my mom would find rotting sandwiches in my cupboard.
And what about your relationships, Jacky? What did this do to your relationships with your friends, your family, your classmates?
I think I was quite conscious about keeping it a secret for a very, very long time. So I still maintained relationships very well with my peers. With my family, they were obviously the ones who saw the depression more than anyone else, because I would just hide away when I was at home, lock myself in my room, not want to talk to anyone, not eat dinner. But in terms of friends, if I went to their birthdays and things, I'd just say, you know, my stomach's sore, so I can't eat. Things like that, or not sitting in a restaurant. I couldn't have anyone look at me eat, so it would only be takeaways, but then I'd sit in my room and secretly eat it. I couldn't eat in front of my family or friends.
Wow, all right, Jacky, and definitely a very emotional journey for you as well. You went from anorexia to overeating as well, so you battled that as well for the longest time. Tell us what happened there. What triggered that?
So I was healthy for quite a few years. As I mentioned, I did actually attend Akeso Parktown when I was 18, and that was amazing. It was honestly the best thing I ever did for myself, and I could manage my depression and my eating for years after that. And then I think my dad got ill. Sorry.
No, it's fine. It's fine, Jacky. If you're not able to continue, it's fine. We can leave it there. And just maybe just a quick last word, if you are able to tell us, just what's your life like now?
My life is very balanced. So I work very hard. I eat very well. I eat healthy, so it's, you know, chicken breast, broccoli, just trying to get in as much nutrition as possible. Sometimes if I don't feel like eating, I don't have to eat. If I want to have a binge day, I'll have a binge day. But I just make sure that I balance, you know, the rest of the week as best as I can.
Oh, you're a very brave young lady, Jacky Schwarz. Thank you so much for sharing that journey. It's not easy, like we say. You know, there's a lot of stigma attached to this. A lot of people feel shame over it, and you've undoubtedly helped millions of people this morning who are probably battling this as well. If you have just a last word of advice, if you want to say anything to somebody who's probably going to fall into this or on the brink of falling into this, what would you say to them, Jacky?
I think the most important thing to remember is that the eating disorder is often a manifestation of something else in our lives. So we can't just look at the eating disorder and try and address it and fix it overnight. There are underlying issues such as anxiety or depression or built-up trauma that has never been dealt with. And I think if people can actually sit and ask themselves, what has my life journey been like? What are the traumas that I've been through? Have I dealt with it? Have I confronted certain issues? And slowly start working on yourself so that you can actually identify the issue and start working on your self-confidence and empower yourself when it comes to food, especially.
All right, Jacky, thanks so much once again for being brave and sharing that experience with us. We wish you the best of luck with the rest of your journey here. It is a lifelong journey, as we heard Jacky Schwarz there, and she survived anorexia at a very young age as well, and is on the road to recovery. Well, that is it for the Health and Science Focus for this week. Thank you so much for joining us. I hope that we've helped you to help yourself immensely. Up next, your headlines.